We are talking health this afternoon and bringing together some of Dubai's most in-demand doctors and speaking to their patients as well. Now, we've heard several times about people undergoing kidney dialysis, kidney transplant, and there's a probability you probably know someone, a family member, a friend or a relative. My dad is currently living with one kidney and is doing brilliantly. But it is something we do need to have a little bit more understanding about kidney health. Prevention, as we always say, is better than cure. According to a statement from medical expert from Seha Kidney Care in 2021, 1 in 10 people worldwide has chronic kidney disease, and 9 out of 10 patients are unaware of their condition. So what are the signs we need to look out for? Do we need a regular kidney check? To answer all of this and more, joined by Dr. Rachna Sahiani, the consultant nephrologist, I hope I said this right, at Saudi German Hospital. We are going to be speaking to 2 kidney patients as well, one who's been undergoing dialysis for 10 years now, and another who's had a kidney transplant. Dr. Rachna, thank you so much for being with us today. How are you?
I'm doing great. Thank you so much for having me on board. This is such an important topic, and I'm so honored to be here and speaking to everyone, your listeners, about this condition.
Those stats really shocked me, that lack of awareness. And it's not often through any of our own fault. It's just simply we haven't been informed of the signs and signals we should be looking out for. The things might not be quite right. Can we break it down? And I know this is your bread and butter,
Sure.
You talk kidneys all the time, but can you explain what function they perform in the body?
Sure. So, this is so important, the lack of awareness. I want to start off with that. As you said, like 9 out of 10 people are not aware. Why is that? Because the kidneys are excellent organs and they are so resilient that unless you lose 90% of your kidney function, you may not have any symptoms.
It gets to that stage
Yes,
before you might even be
exactly.
alerted to it.
So the early signs are frequently not present and people are not aware. So unless you go and see your healthcare provider and get a checkup, you would never know. So what do kidneys do in your body? So there are 2 kidney bean-shaped organs that are lying in your back along the spine. So the right kidney on the right side and the left kidney on the left side. And the kidney connects via a tube into the bladder. So the kidney filters waste and it clears toxins from your blood and it regulates the salt and water content.
Okay.
So a lot of times there are patients who are not aware that they have kidney disease. What are the symptoms that people might have? They may have salt and water retention in terms of leg swelling, face swelling. They may see foamy urine. They may see blood in the urine, red urine. They may have just fatigue, itching. They may not be able to place a finger on it. They don't feel good. And honestly, the best thing would be for them to just have a yearly physical and getting some tests done.
So when you say getting tests done, and I've had this before, like a kind of executive women's check where, you might have ultrasound and smear and blood tests, would it come up in a blood test?
Absolutely.
What would you be looking for?
There are a few tests that are absolutely important. A lot of times packages may not include a urine analysis. I mean, that's such a key part. Serum creatinine. So you want to make sure your package includes a urine analysis. It can look for protein in blood or white cells in the urine that give you an indication that the kidneys may be a little inflamed. Also, a serum creatinine is a simple blood test. It's part of most panels, and that gives you the health of the kidney. Now, a lot of times, the creatinine may still be in the normal range, and you may have kidney issues. And the way to pick that up is also checking your blood pressure, because that's another sign that tells you something may not be healthy with the kidneys. A lot of times, as people age, and after 35 you get something called essential hypertension, but there are times when you have kidney diseases that lead to blood pressure. So it's something to keep in mind.
Can I ask you about kidney stones? Because someone I know is suffering. Can you give us a quick rundown of what they are and how to get rid of them?
So kidney stones rarely run in families. A lot of people have family history, so they are, and people who don't drink enough water or work in jobs that require them to be out in the sun, and so they are dehydrated. And most commonly, kidney stones, they are basically chemicals that sort of form in the kidney or in your bladder. And the way to prevent is to drink lots of water. You want to keep your urine color almost colorless. You don't want to see dark concentrated urine, especially if you have a history of kidney stones. And then there are lots of stones, calcium oxalate, uric acid. A lot of it ties into whether you have diabetes, what's your diet, high animal protein, salt, sugar. If you're excessive on that, things to keep in mind, yeah.
We are talking kidney health this afternoon. Dr. Rachna Sahityani is with us today, consultant nephrologist at Saudi German Hospital. If you've got any questions of her, want to share your story, want an expert second opinion, we'd love to hear from you. We're also going to be speaking to not one, but two patients who have had kidney problems who are going to be sharing their story. That's next.
Healthy Habits
on Afternoons with Helen Farmer.
We are talking health on the show this afternoon, and I do think it's so valuable that when we're hearing from doctors, we also hear from patients as well. And with the focus on kidney health, we have brought to the show Aldwin. He is speaking to us as a civil engineer, but also a patient who is undergoing hours of dialysis 3 times a week due to hypertension. He's having that at Mafraq Hospital in Abu Dhabi. Aldwin, thank you so much for being with us. How is your health today? How are you feeling?
I'm good, Helen. Thank you for this invitation, and it's my honor to be in your radio station.
Oh, we're really lucky to have you with us. As I said, you spend an awful lot of time working really hard, but also a lot of time trying to get better a little bit. Can you tell us how and when you found out that you had a chronic kidney condition? What were some of the signs that something wasn't quite right?
Actually, a week before that I was diagnosed with a chronic kidney failure, I already had this body symptoms. I already had this low back pain. I easily get tired, meaning even though I walk a few meters, I was already gasping for air. And I have this metallic smell on my breath, and I had this itchy skin, and I feel always nauseated. But the bad thing was, it's not the symptoms. I really thought it was another thing. I thought it was only stress. So I did not go to the doctor, and the only time that I found out that I had a kidney failure is I have this story that I cut my nails a day before I went to the doctor, and my nail got infected. It was swollen. I was in pain. So I went to the hospital, not because of my symptoms, my chronic kidney problem, but I went to the doctor, to someone to check up my finger, which is not related to my kidney. But when I went there and I was in the line for this registration, there's one lady beside me, and I soon found out she's a doctor. And she told me why I was there. I told her that I had an infection in my finger, and she told me, I think you should also check for your blood chemical or blood test. You should have. Yeah.
Really?
To make the long story short, my finger saved me, because when the doctor find out that my creatinine is so high and my kidney already failed, he said if I prolong it even further, I may be dead. You know, I believe in divine intervention, Helen.
Wow.
So,
what a woman! What a woman! So a cut finger has led to you being on the road to recovery.
Yes, and I said earlier, I thought it was only stress, so I was not worried about this pain in my back and my nausea. I feel nauseated at that time also.
Goodness. So, what do we know about the cause, Aldwin? Is it lifestyle? Is it genetics? You know, what have the doctors said?
I was hypertensive since I was 18. So my blood pressure is always, the reading of my blood pressure is always high, like 180 over 120, 200 over 120. But the bad thing was, I'm not feeling anything. So even though my blood pressure is, other people, when their blood pressure is high, they feel pain in their neck or in their shoulder, and they are dizzy. But for me, it's normal. So I thought it was normal. And the doctor said because it was prolonged high blood pressure, the veins in my kidney popped. So because of the pressure, so it affected my kidney. So that's why my kidney failed. So that's it, I think.
Aldwin. So when the doctors gave you that diagnosis, did they say, it's dialysis, now, or it's medicine now? What was the initial plan, and has it changed?
When the doctor called me after the blood test, following day, the result, he asked me to go to him immediately. He gave me the bad news. Kidney failed. I have a very high creatinine. Creatinine, I think, is the amount of minerals and in my bloodstream. So the toxins in my bloodstream is getting high, because the function of a kidney is to filter these toxins, to filter these chemicals that our body doesn't need. So it's very high. He told me that I have to go to the emergency as soon as possible. So I ran to Sheikh Khalifa Medical Hospital, and it's the same diagnosis. I have chronic kidney failure, and they put already a pipe in my chest so I can be dialyzed immediately, because if it will be prolonged, I will be poisoned. My body will be poisoned. So that's the start of my dialysis journey. And from then on, I'm doing dialysis for 10 years already.
So Oh my goodness, that's a lot of time. Now, as I said, you're a civil engineer, you must be on site. How challenging is it to fit these the thrice weekly sessions, 4 hours, into your normal life?
There's a myth about dialysis patients. There's a lot of people think that if you're undergoing dialysis, you cannot live a normal life. But if you are used to dialysis already, you can still live a normal life. And for instance, for me, I still go to work and do site inspection. So what you have to do if you are a dialysis patient is to get your treatment and don't skip treatment, and that will give you a normal life. Yeah.
Now, as you said, you've had dialysis for 10 years now.
Yes.
Would you think about having a kidney transplant? Is that something that the doctors have mentioned, Aldwin?
Yeah, thank you for asking, because the transplant coordinator of Sheikh Khalifa Medical Hospital called me 2 weeks ago, and she is already arranging for my transplant. But unfortunately, my donor is still in the Philippines. He's my nephew. So I still have to bring him here. And then we can proceed on the process of testing. And we have to check if we are compatible. Compatibility is very critical for a transplant to undergo for this procedure.
So one of my best friends, her parents, over the summer, her mum donated a kidney to her dad by a complete chance. They're obviously not related, but she was compatible. So my poor friend Beth had to sit there and be like, oh my goodness, my mum and my dad are having this surgery. And, thank goodness it's worked out so well for them. So
how is he right now?
They're great. They're both, it's like been like a new lease of life for her dad. It really, really has. It's been fantastic. And then weirdly, my dad had a kidney removed last year, and he's been doing fine with one. So it's really interesting to think that this is far more common than we might have realised. And
exactly. Why your dad's kidney was removed?
Because he had cancer, so he had a tumour attached to his kidney about 10 years ago.
I understand. Yeah.
It was just filling it with water, and it was only operating at about 2%, and they were worried that it was going to get infected, so they removed. And is there anything you'd like to share with listeners about your experience, or anything you think would be useful for anyone who might be worried, even about symptoms that you were experiencing, Aldwin?
Of course, especially for the young people. This is my mistake, so it's too late to dwell on my mistake, but I would like to tell the young people that even if you are young, please don't use or input chemicals to your body that will destroy your body in the long term. For example, smoking or alcohol or sleeping late at night, all of these things. When you are young, your body can still absorb this. But tell you, when you get older, when you're in 30s and 40s, your body will charge you for what you have done to your body.
It's going to come back. It's going to come back.
And don't self-diagnose. We have a tendency that when we feel pain on our back or we have a headache, usually where we go to is not to the doctor, we go to Google. We check headache, what's the symptoms, what is the causes. And we say, probably Google will not tell you the truth. You should go always to the doctors. Don't self-diagnose.
Real doctor, not Dr. Google.
A real doctor. Yeah, exactly. That's my mistake also.
Well, thank you for sharing everything you've been through and that you're going through, and fingers crossed it works out with your nephew in the future. Please keep us posted. It's wonderful to hear you sounding and feeling in such good health, and wishing you all the very best going forward, Aldwin. Thank you for your time.
Thank you, Helen.
Healthy Habits
on Afternoons with Helen Farmer.
We're talking kidney health on the show today, whether it is prevention or dealing with chronic kidney disease. We heard earlier from Aldwin, who's on dialysis 3 times a week. We're going to be hearing from a transplant patient next. Anand is with us. Also joining us here in our studio at Roxy Cinemas is Dr. Rachna. She's a consultant nephrologist at Saudi German Hospital. And I'd like to start with prevention, if you don't mind, Doctor, because there will be people listening today who might be living with kidney ill health, pain, might be concerned about it because of a history in their family. But for everyone else who perhaps this is not on their radar, what could we all be doing, changing, trying to avoid having to come and see you in your office?
Yeah, this is really important. So things that you can do to prevent kidney disease is maintaining a healthy weight, exercising. It's really all those lifestyle measures, exercising 30 minutes, 5 days a week, smoking cessation, eating a healthy diet, low salt, low fat. If you do have high blood pressure, controlling your blood pressure, make sure your goal is less than 130/80. For most people, that's really the goal. Diabetics, even a lowered goal. Controlling your blood sugar, if you're a diabetic, is very important. Go for your routine physical exams, go see your healthcare provider. If you have microalbumin in the urine, that's a warning sign. You need to take care. There are medications that can be used. So I think those are measures that most people could follow.
And are there any little habits or surprises that we might not know about that could be perhaps damaging our kidneys without us realizing this, doctor?
Medications, we don't think about it, but a lot of painkillers on a regular basis for a prolonged period of time. We pop Brufens. Once in a while it's okay, but people who take that Voltarens that are given will reduce kidney function.
This is me. When I had my wisdom teeth taken out, I was like, bring on the Brufen, and the pharmacist said, just to let you know, just take one of the 800. And I was like, I haven't been doing that.
Or 3 days or 5 days, it's okay, but we're talking months.
Prolonged. Okay.
Years.
Phew, I'm no longer popping the pills. Let's go very quickly to the text line if you don't mind. I'm going to squeeze in one question before we catch up with Anand, saying, I noticed pain in my side yesterday. Feels like I've got a constant stitch. It's still there, and a bit of Googling tells me it's most likely a kidney infection. My pee is a bit cloudy, but there are no other symptoms. Can I flush it out by drinking plenty of water, or better nip it in the bud and see a doctor?
See a doctor. That's what a doctor is going to tell you. You need to come in and be checked, because a lot of times Google will not give you the right advice. It'll scare you. It'll tell you have kidney cancer or something like that. It may be something as simple as a urine infection, but you want to, as I said, kidney disease is a silent disease. It doesn't give you any symptoms till it's very late. So come in, get a urine test done, get a blood test done, check your blood pressure, and we can take it from there.
All the best. Hope you feel better. But yes, go to the doctor and stay away from Google. Anand Prakash is with us this afternoon. Hi. Great to have you with us, sir. Now, we are talking kidney disease and getting your first-hand experience of this. You've undergone a transplant yourself. How and when did you first find out that this was going to be an issue for you health-wise?
Okay, so I didn't recognize it till it was very late.
Just like Doctor was saying.
Yeah. So I was traveling from Dubai to India back home, and then at that point I felt some uneasiness. I was not feeling well, so I just visited a regular doctor for normal checkups. And in those checkups, they did this kidney function as well, and they found the number was not good.
Alarming.
Yeah, they were alarming. They said you must go on dialysis immediately. Yeah.
Oh my gosh.
So I got diagnosed there, and they initiated the process there. It was late 2017, and then I came back here and met Dr. Rachna, and then she took over for 2 years. She took care of me in dialysis, and then in late 2019 I underwent the transplant.
It's a significant decision to make, because not only are you then having to undergo a surgery and the recovery and life post-transplant, finding a match is, it's a big deal. Who was your donor, and what was that match process like?
So for me, it was fortunately in family, my elder sister.
Amazing.
So she offered me to have her kidney in the beginning itself, but somehow I had that belief that it's something that can be fixed over a period of time, but it continued to linger on, and then when finally I absorbed it that it's only way possible is to through a transform that I'll be better. Then we decided to go for it.
What an amazing sister you have. She must love you very, very much.
And she's doing really well after the donation, and she's good as well. Yeah.
Doctor, is it true, and I only read this today, is it true that when you have a kidney transplant, you actually put an extra kidney in? So Anand today and anyone who else has had a kidney transplant is actually living with 3?
That's correct. They have their 2 native kidneys. We don't generally remove them unless there are some polycystic kidney. They have huge kidneys, 17, 18 centimeters. You would remove one just to create space.
Okay.
But then, yes, they're living with 3 kidneys, 2 non-functioning and the transplant kidney functioning. And his sister who donated him is living a good life with 1 kidney. So most people can live with 1 kidney.
So what if you needed to have multiple transplants? Could you be living with up to 3, 4, 5?
People, it gets harder, as the numbers go up, because you get a lot of antibodies that develop. But yes, people go in for the 2nd and 3rd transplants. So they go from the right side to the left side. It's just put under the skin, in your belly.
And then how's your health now? You're looking great.
Yeah.
Thank you for joining us. How's it been post-transplant?
Yes, I have been following all the advice that doctors gave me.
Good.
And trying to keep my weight under control. And
I'll keep you away from the caramel popcorn then.
Yeah, and take daily walks. a few things I keep in mind that I mostly I eat at home, the home cooked food. I avoid eating outside.
Yeah.
So you know what you're having.
Yeah.
The low salt content.
Low salt, no colas and nothing. I mean, it's water mostly. So.
You're a good patient. And
yes, he's an excellent patient. He follows all the advice.
that's why he was allowed to come on the show today. And lastly, Dr. Rachna, for anyone out there, what would your message be if you could change one thing, do one thing, try one thing? It might be a supplement, an exercise, a daily habit to ultimately help with your best possible kidney health. What would you recommend?
I would recommend exercising, maintaining a healthy weight. It all ties in. Lifestyle measures tie in, because if you are healthy weight, your blood pressure is under control, your diabetes is under control, your blood sugar is under control, you're not smoking. Lifestyle measures is what I would say most people should follow.
And lastly, we're asking everyone to get in touch this afternoon saying, would you rather never sweat during a workout or never get sore during a workout? And you have a medical take on this. What's your perspective?
So I was listening to this on my way here, and I said, you know what, I hate washing my hair every time, every day, go to the gym and then wash your hair. But I would not be sore. And how that ties in is, a lot of people, they go to the trainers, they're working 2-3 hours, leg day, huge muscle groups are being worked on, and then the next morning they pass blood in the urine or have dark urine. And it's just, muscle breakdown from intense workouts. You need to make sure you're well hydrated, you avoid alcohol right before, and just take it easy. Don't overdo it, because then you can run into trouble with that. So I'd rather sweat than be sore, despite, all the hair washing.
The hair struggle is real. Men don't appreciate what we have to go through. Dr. Rachna, thank you so much. And as well, great to see you in such great health. And thank you for downloading this episode of the Afternoons with Helen Farmer podcast. Don't forget, you can subscribe. You'll get it direct to your phone as soon as it's out. And you can listen to me live on Dubai Eye 103.8, Monday to Friday between 2 and 5 p.m.
You've been listening to a Dubai Eye 103.8 podcast. To enjoy lots more from Dubai Eye in the United Arab Emirates, just go to DubaiEye1038.com or find them wherever you normally get your podcasts.